I would like to ask you permission to use this video for educational purpose and on internet.
That's fine, thank you.
Now, you had multiple surgeries and we couldn't fix your problem all at once. May I ask, first of all, how old are you? How old you are?
I'm 84.
84. Now, tell me about your symptoms before we started. What were you struggling with before we started?
Severe back pain, running all the way down my legs, and if I bent over, it was very severe at that time.
Yeah, 1 to 10. How bad would you call it?
Oh, it was 7, 8 at least. Yeah.
7, 8.
Yeah.
What was your daily activity like with that kind of pain?
Very limited. Very limited. I couldn't lift hardly anything without severe pain. Walking was really a big problem.
Yeah. Now, and how far or how long could you walk before the pain had to stop you?
Oh, I could walk down to the end of my driveway, but then that was about it.
That was it. Yeah. Now, how are you now? Now you had the surgery in 2017, then you had another surgery in 2019, and then we did the last surgery. We go over that in 2022. How are you now?
I'm doing fine. I can walk normal distances now, like down to the mailbox, and I visit up at the care center with my mother-in-law, and that's a pretty good walk.
Okay. So that the pain you had before is gone, and the daily activity is where you expect it to be?
Yep, I can handle that. Lifting is still something I'm very careful of, because if I have any issues, and it's from bending and lifting. So.
Yeah. And that is actually the reason we are having this conversation, is about that you had more than one problem, and you had the multiple problem in your spine that we fixed some, and then we had to go and fix the other ones. But as well, last year we fixed your sacroiliac joint.
Yes.
Now, can you tell me, what were your symptoms before the sacroiliac joint, the last surgery? What were your symptoms before we fixed your sacroiliac joint?
I was getting pain that radiated right down into my toes.
Yeah.
On the right side, and it was and it hurt, and it was like an electric shock.
Yeah. And was it very similar to the symptoms you had before the other surgeries?
Yeah, it was.
Yes, and that is one of the reason we're having this conversation. If you don't mind to hold this.
Sure.
See, this is the lumbar spine, is one of the area that we fixed. Just next to that is the sacroiliac joint. And right here is the nerve that goes to your toes, is coming out. Right here, actually. We call that L5 nerve root. Do you see how close that nerve is to both to the disc here and to this joint here? Any problem either place can cause similar symptoms. And sometimes, if you have two problems that pushing on that nerve, we have to fix them both before you get a permanent improvement. Because nerve doesn't care if this here is irritating it or this disc here is irritating it. Nerve really doesn't care.
Yeah, it's irritated.
It's irritated. It gives you the same symptoms. Same way that you really don't care if one person bothers you or another. Somebody's bothering you.
Yeah, that's right.
So, but what we are getting at is that you have two sacroiliac joints. As you see, you have one here and one here. And many times problem is both. As a matter of fact, your problem is in both sacroiliac joints, but we fixed only one side. We fixed the right side, correct?
That's correct.
Now, tell me about your symptoms right now, about the right side and left side sacroiliac joint. How do you feel about? How do they feel?
The right side is while the bone hasn't totally grown yet, according to our meeting today, it is mildly irritating. Okay.
But that symptom you had before that is
gone.
That's gone.
Yeah. I can move. No issue there.
Excellent.
The left side is a little more irritated, but that has not been corrected yet.
Well, and that's something that I tell all my patients. You have two of that joint. This is one of the surgeries that when you fix one side, people can use it more. That actually improves the other side's odds. But generally, we say 50% of the people do need both sides fixed before they get a complete improvement. And sometimes as well, we notice that if you fix only one side, people are going to sometimes overuse it, which is not the case in your situation. But so we have to have an eye on both sides, so to say. to get a good improvement. Now, your daily activity at this point is at the level you like to have it?
I can do most anything now.
Okay.
Yeah.
Well,
I do not do heavy lifting.
Yeah.
I avoid, real strong twisting.
Yeah.
But that's good common sense. So
Yeah.
other than that, I can drive. For instance, I drove 2 hours here today,
Good.
and
No problem?
no sweat at all.
That would have been a problem before.
Oh yeah, you used to have to stop.
And and I think one of the reasons, so far, are you happy with what we delivered?
Very, very much.
Excellent. Now, one of the reasons you're happy with the result we delivered, because you have a good common sense and your expectations are realistic.
Well, you've brought up all of the different things to think about, and so I fully understand our
And
circumstances.
those are my favorite patients who understand everything about the problem because they're realistic. Like I tell that sometimes that I had a patient that, as we discussed, that the pain in the back was gone, pain in the leg was gone, but he couldn't do motorcycling, and he was as well your age group, but that was his hobby. He couldn't do that anymore, so he still wasn't really happy with me because I couldn't put him back on his motorcycle. Now that's one of the things I tell to lots of people: when you're young, have a lot of hobbies, because some of those hobbies you may not be able to do when you get older. If you have many hobbies, then you still have few things that are good for your heart. Okay, so what do you do as a hobby?
Well, right now I've been spending a lot of time up at the care center taking care of family.
Oh, okay.
But other than that, I like to do puzzles, and I like to take short walks, and
these are perfect hobbies.
yeah,
Short walks and board games and things that don't require you to go climb a tree or something, or go on a motorcycle trip for 5 hours.
Well, I know I'm not going to be 30 again, so.
And that's actually, and everybody says that literally with their words, that they understand nobody can get younger anymore. Yeah. But in our heart, sometimes we really wish that to be the true. And we expect that. That is even worse. And that is, we call that the eternal dissatisfaction. Because if this is what you really want, to get younger, you will be always disappointed.
Yeah, I'll be very unhappy.
Yeah, always. But I think that's part of the happiness, is to understand our aging process, understand limitation that has to do with your aging process, and finding hobbies, more hobbies. As a matter of fact, we did a video on the YouTube, and I recommend it to everybody. It's called A Natural History of Spine. That I recommend to everybody. Watch it with your children who are younger. Then that gives a lot of information about not only what expectation is, but as well how to do to put you on a better curve that not overstress your spine and so on. So if you have time, watch it with your children. It's called A Natural History of Spine.
I'll do that. Yeah.
Well, thank you so much for the interview. I really appreciate that.
Thank you, sir.
You're very welcome.